Hi, it's Kristen here at UT Southwestern Medical Center. Thank you for joining us for the first of 4 Facebook Live chats we have as part of Breast Cancer Awareness Month. Today we're going to be chatting with Dr. Asal Rahimi. She is a radiation oncologist here at UT Southwestern, and she specializes in working with breast cancer patients. So we're really happy to have her.
Thank you so much.
It's gonna be fun. So a couple things before we get started. We want to make sure that if you are listening, make sure that you like and share this conversation, and you want to ask your questions in the comments field. We will take as many as we can get to in our 30 minutes, so those can start coming in right about now. And in the meantime, we hope you get some good information from this. So Dr. Rahimi, thank you for being here.
Thank you so much. It's a pleasure to be here.
This should be an interesting conversation. So kind of one of the first questions, now you obviously specialize in working with women with breast cancer. So what are the different ways that you can do partial breast radiation?
Great. Well, let me just start off by explaining whole breast radiation and then comparing that to partial breast radiation.
Okay.
So one of the most standard ways of treating whole breast radiation is essentially over 4 to 6.5 weeks. So essentially it would be every day, Monday through Friday, one time per day, with basically 2 tangential breast fields. So it ends up being a very large area. It's the entire breast. So you can imagine that takes a lot of resources on a patient's perspective to come into the radiation oncology suite every day.
Right.
So partial breast radiation, this basically started probably several decades ago, about 2 decades ago, and there's different ways that partial breast radiation can be delivered. So I do want to preface by saying that it is not standard treatment as of yet. It's still considered investigational, and we're waiting for a very large phase 3 randomized controlled trial to deliver the results that is comparing partial breast to whole breast radiation before it becomes standard of care. So the ways that partial breast radiation can be delivered, so essentially instead of treating the entire breast, we're treating just the area of the lumpectomy cavity and a small area around the lumpectomy cavity. One way is to use a brachytherapy catheter. So some of the older brachytherapy catheter devices were balloon based. So essentially after the surgery, either at the time of surgery or maybe like a week or 2 after surgery, after pathology comes back, the surgeon will then implant this kind of device inside of the lumpectomy cavity, and then you'll have a catheter that comes out of the cavity. And then we would hook that up to what we call a high dose rate brachytherapy machine. So it's a machine. And then there's now newer devices. One of them is the Savvy. It looks kind of like an egg beater, or the Contura, which is also a balloon-based catheter. And these treatments are delivered over 5 days, 2 times per day. So these that's one of the most standard ways of delivering partial breast irradiation. Other ways that it can be delivered is with interstitial brachytherapy. So a radiation oncologist would essentially implant catheters through the lumpectomy cavity. So it can be numerous catheters, 10 to 15 catheters. It kind of looks like little straws that can be implanted into the lumpectomy cavity. And then again, those catheters would be connected to our HDR device, our high dose rate brachytherapy device, and treated twice per day over 5 days. And usually they're about 6 hours apart. The fourth way that we can deliver partial breast irradiation is with an external beam radiation therapy technique. And that is just using a simple, basically a linear accelerator, which many pretty much all radiation oncology suites will have a linear accelerator. But one of the things with the linear accelerator is that the patient is breathing during the radiation treatments, obviously, and you do want them to breathe during the radiation treatments. Yeah, it's a great thing. And so we have to actually expand our lumpectomy cavity, and in some protocols, it's up to, by the time you take all the expansions, it's like 2 to 2.5 centimeters, which then ends up being a large portion of the breast. So the whole point is we're trying to minimize the area that we're treating in the breast, because we're giving this area a high dose. So those are the most standard ways of treating partial breast irradiation.
So I know one of the things you've used CyberKnife, And now I understand that may not be standard of care yet, but can you talk about how CyberKnife is used for breast cancer specifically?
Right. So back in 2010, we started a protocol here. It was a phase 1 prospective study looking at delivering partial breast irradiation on the CyberKnife machine. And essentially what is special about the CyberKnife machine is that we call it a robotic radiosurgery system. So essentially it's it's like a linear accelerator in that it still delivers radiation, but it has many more angles that it can deliver the radiation from, and it has a robotic arm, so it can come from many different angles, and also it can do real-time tracking of the tumor bed. So as the patient is actually breathing, we can account for where the position of the particular target is at the patient's breathing cycle, which is great because what that translates to clinically for us is that we can reduce our margins. Because with a regular linear accelerator that doesn't have that capability, we have to treat a larger margin to account for tumor moving as the patient is breathing. And so with the CyberKnife, since it has the real-time tracking, the machine can actually account for those treatments and move up and down or in whatever position it needs to as the tumor or the tumor bed is moving with respiration.
So that it sounds like it's a lot more accurate.
So
yes and no?
Yes. So there is more accuracy with the CyberKnife because we're treating with many small beams. And so we can have reduced margins, and when we're treating very high doses of radiation, that's something very important because we want to try to minimize the amount of radiation that normal tissue is receiving.
Absolutely. So we're going to take a minute. We're starting to get a bunch of questions in, so let's start with these. So we have one here, are from Sierra. Are there any risks when using the CyberKnife for breast cancer treatment?
Right. So with our phase 1 study that we had, we enrolled 75 patients onto that study, and one of the outcomes that we looked at was toxicity. And so when we compared it to whole breast, we didn't compare it to whole breast radiation. It was essentially just a phase 1 trial, a single phase arm study, but there were several patients that got dermatitis, which is redness to the skin, which with whole breast radiation, essentially for the majority of patients, they will get redness to the entire breast. We did have several patients that developed redness to the skin to a small area, and we have seen this in other partial breast modalities as well. And we did have one patient that had a rib fracture in this study. It was the very first patient that we treated, but after we changed the dose that the rib was getting, for subsequent patients, we did not see that anymore. So we actually learned something from that particular patient. Another toxicity that we saw on the CyberKnife trial, which is also seen on other partial breast modalities, is something called fat necrosis. So we had 10 women that developed fat necrosis. Of those 10 women, 5 of them were asymptomatic. And what fat necrosis is basically like, you can kind of think of it as like scar tissue formation in the breast. Some of the breast tissue can kind of just harden. And usually it is not anything that is dangerous, but it can be painful. In some of those women, there was pain associated with it, and half of those women, but after we medicated them, they seemed to get over that kind of acute pain syndrome. But on palpation, you can kind of feel like a little bit of hardness. But again, this is something that you can see with other partial breast modalities, and it was very comparable in the rates that you see with other partial breast modalities. So none of this was surprising to us, and it was still within the realm of the other partial breast modalities that we've seen.
Good question to start us off.
Yeah.
So we've got one from Veronica. She says, she's asking for, this is a treatment for, I believe she was talking about CyberKnife, what it can be used to treat, and how do you qualify? It sounds like it depends on what you have.
Right. So we are treating CyberKnife patients mostly on clinical trials here at the university. And so the trial that we had is now closed, and that was for a 5-fraction regimen. Right now, currently, I have a trial that is open that is a 1-fraction regimen. So that basically means 1 treatment of radiation and you're done.
That's it?
Just one treatment. So, standard whole breast radiation is anywhere from 16 to 33 treatments, and now we're doing it in one treatment. But of course, we can't offer this to everybody because, again, we're treating very high doses of radiation. And so some of the qualifying factors for our study that we have is early stage breast cancer patients. So essentially stage 1 or any tumor that's less than 3 centimeters.
Okay.
And then we also look at margins. So when the surgeon removes the tumor from the breast, we look at the margins of the resection. So we look at how much normal tissue there is from the edge of the tumor to the edge of the specimen, and we want at least 2 millimeters. So that was actually in our 5-fraction trial. Some of the recommendations for invasive disease has changed, and it can now be tumor on ink. But for the trial purposes, we want clean margins. So we want margins to be clean. And then also we don't want patients that have lymph node involvement because, again, we're treating partial breast, so we're treating to a very small area. And
that's different.
Yeah, and we want to make sure that if they need to have their lymph nodes treated, that we're going to provide adequate treatment for them.
Okay.
And then we also have, for the 1-fraction trial, we have size criteria.
Oh, wow.
So, yeah.
It's very specific.
The 1-fraction trial is very specific, and then with the 5-fraction trial that we had, it was a little bit more broad.
Okay. So we've got one in here from Lori. She says, will partial breast radiation harm my skin? I know you talked a little bit that it can be red.
Right. No, so it shouldn't harm the skin. With standard radiation techniques to the breast, most patients will get redness to the skin, so it will be like a sunburn. And then usually this will clear up with time. So some patients can actually have peeling of the breast. So it's very similar to a sunburn.
Gotcha.
And so what we have found with this particular modality of partial breast radiation, a lot of women didn't even develop this dermatitis, but we did have a handful of women that did. And you can get some long-term skin changes after any type of radiation, and usually that can be some fibrosis to the skin. But again, none of this is usually serious, so this is all expected.
Kind of a small matter there. So we've got another question. This is from Mary. I think you talked to her a little bit ago. She said, how do side effects with CyberKnife differ from other types of treatments and modalities for breast cancer patients?
Right.
And it's going back to the CyberKnife, which you've only done in clinical trials.
Right. So, so when we compared it to other partial breast modalities, and our study didn't do a head-on comparison, just when you kind of look at the other data that has been published for partial breast, there is data showing, the rib fractures, showing the redness to the skin, showing patients that have gotten fat necrosis. And our data is very similar to some of the other partial breast data. I think one of the things that we did learn on our study was this fat necrosis and what patients are actually more prone to developing fat necrosis, and it comes down to volumes. So the larger the lumpectomy volume that we have to treat, the higher the incidence of developing fat necrosis. And so that's part of the reason why we have some of these size constraints for the current trial that we have. But I think that those are kind of the major side effects with just the skin, and then the rib fracture if you get too much dose to the ribs. But these are all things that we can monitor and predict for, and so the incidence of it should be pretty low to have a rib fracture.
Really good questions so far. So thank you guys for all the questions. Keep them coming. We're about halfway through, so definitely get your questions in now. Wanted to ask, is obviously, you're starting to look at CyberKnife as an option for breast cancer patients.
Right.
What are some other options that are available to patients that come in?
Right. So this particular study that we've been talking about, these are for early stage breast cancer patients. We also have some studies for stage 4, so metastatic breast cancer patients, and so essentially delivering what we call stereotactic body radiation therapy to women that have limited amounts of disease. So that's another study that we have, which is a cooperative group trial. And then we also have a study. We do a lot of breath hold techniques in our department. That was one of the programs that I started when I came to the university, was basically having women hold their breath during their radiation treatment. And basically what that does is it makes the lung expand with air. And in doing that, as the diaphragm moves down inferiorly, it pushes the heart posteriorly and inferiorly, and then we're essentially moving the heart out of our radiation field.
Oh, wow.
And so it's a cardiac sparing technique, and we're protecting the heart by doing that. And we standardly do that for all of our left-sided breast cancer patients. So we have a study looking at that in different modalities in which to treat women with these cardiac sparing techniques.
Wow.
And we will be having several more trials open here in the next couple of months.
That's a good point, actually. So we've been talking about a lot of different treatments and a lot of different clinical trials. How do people become involved? Do you let them know when they come in as patients?
Yes. So every patient that is seen in the breast radiation oncology in our realm, I guess in our world, that comes here to the university, we basically will do the screening for you. So when you come in and you're seen here as a patient, I and my other colleagues will tell you, well, you're eligible for this trial, or this trial, or you're not eligible for this trial, and why you're not eligible for this trial. So that's something that your physician can tell you and really kind of guide you.
Okay. So we've got another question in here from Crystal. She says, using the CyberKnife system, what specific types of tumors? Are there different types of breast cancer tumors that you've looked at treating?
Yeah, so the most of the partial breast irradiation candidates that we've treated have been hormone positive breast cancer patients. And so the other ones are eligible, but we did not have, on the 5-fraction regimen, we did not have any woman that had chemotherapy. And so even though it is an inclusion criteria, we did not do that because we're changing the fractionation. And so I mean, I think in general, most partial breast candidates are usually the hormone positive breast cancer, but not to say that you can't treat the other ones. I think it's just, we need more data for that.
All right, so good question. We need some more data for that. So thinking back to all the different types of radiation treatment that's available, are these processes, how long does it usually take? Is it painful?
Yeah. So the name CyberKnife can sound very scary because there's a knife in there.
Yeah.
But it is not invasive. It is non-invasive. And so patients will not feel the radiation. They won't see the radiation.
Wow.
And so knife should not be in your mind when you're thinking of a radiation with CyberKnife treatment. And so essentially you will see and you will hear the CyberKnife machine moving around.
Okay.
But it will not touch you.
Okay.
And then the treatments kind of depend on what site we're treating and how big of an area we're treating. But generally for the breast CyberKnife treatments, right now they're taking about 30 minutes.
Okay.
But we also have to set the patient up and make sure that we're exactly in the same position. So that can take a little bit longer. And so we recently got a new upgrade on our CyberKnife machine. And so we're able to deliver, these one treatments, one fraction in about 30 minutes. So
and how does that compare to using a different linear accelerator? Is it similar in time?
Yeah, so doing whole breast radiation is actually really quick. So the actual beam on time for whole breast radiation is only 2 to 3 minutes, and then maybe another 10 minutes or so for setup, so 15 minutes a day.
Wow.
But the issue is, I think it's just more getting to the radiation oncology suite on a daily basis, which can be inconvenient for some patients.
Right. And so when somebody does come in, are they able to return to work immediately after treatment?
Yes.
Do they have to go home?
So they can basically come in, get their treatment, and then go back to work. And they can be around pregnant women, they can be around children, so they are not radioactive. They can sleep next to their spouse. So there's no radioactivity, internally in the patient that they would experience. So they can just go back to normal life. They can come on their lunch break. So we try to make it really convenient for people.
That sounds really good. So I want to ask another question, and this is something that came through earlier. We've talked a lot about you're looking at CyberKnife. there's some talk that UT Southwestern may be getting a gamma pod. I mean,
Right.
what else is on the horizon
Right.
for?
So we have a lot of exciting things happening in the breast cancer world right now. So we do have a gamma pod, and so we are the second facility in the world to have the gamma pod. So
Wow.
it was designed at University of Maryland, and essentially what the gamma pod is a radiation unit. So it's a radiation unit specific for breast cancer patients, and it's specific to treat them in a stereotactic method. So similar to kind of what we're doing with the CyberKnife, and that we're going to be, when we say stereotactic treatments, what we mean is basically delivering a large dose of radiation to a small volume with precision. So kind of focusing that radiation and making sure that we know where the tumor is when we're delivering the radiation treatments.
Okay.
And so this unit is specific for breast cancer patients.